Welcome to Montana Matters. We're joined by Advanced Care Hospital of Montana. With us today, we have Judy Powers. She is the CEO, as well as Dr. Hector Stella, who is the medical director, and he specializes in pulmonary critical care. We want to thank both of you for joining us today. It's so great to have you on the show. A lot of us, we drive past this in the TransTech Center. We've seen your facility, but we don't always know what you offer. Can you tell us a little bit more, Judy, about the services that you offer?
Absolutely. We're a licensed hospital in the state of Montana, and that means that we have physicians that provide care 24 hours a day, and our patients who are there need to have nursing services by a registered nurse every day as well. So they're getting medications and they're being cared for very intensely by our team. In addition, we have an ICU level of care there. So we do get our patients from other hospitals in the region, both here in Billings and as far away as Rapid City and Casper, Wyoming, and of course Great Falls and other cities here in Montana. Our patients are very sick. We say we take care of the sickest of the sick, and whether they've had an accident or an injury that caused them to end up in the hospital, or if they have illnesses that are really chronic and are requiring them to need more time to recover. Okay. That's when they come to us, and on average our patients stay 25 days.
Wow, 25 days, and I know you have a 40-bed facility, so you are helping out people with their health needs for sure. Mm-hmm. Okay, so tell us why this is important to Billings, and I understand this is the only facility of its type in Montana, right? We are.
We're the only long-term acute care hospital in the state of Montana and Wyoming, so we do see a lot of patients from the Wyoming area as well. And we provide a level of care for patients that didn't exist in the past. And when we came 10 years ago to the city of Billings, we noticed that there was a need for these patients to be able to go home safely and return to their prior level of care. But they weren't necessarily needing to stay in the hospital for that entire period of time. So we do education with them. We help them be able to manage their chronic illnesses before they go home, and we set up the patient and the family with time in the hospital to learn in a controlled environment, so that they don't end up having to go back to the emergency room after they go home.
Okay.
And it's diseases such as lung disease, chronic obstructive pulmonary disease, heart failure, liver failure, lots of types of illnesses. Where otherwise they might not be able to stay home.
Right, so it's amazing care that you're offering to them and getting the families involved, and you've been doing this for 10 years like you mentioned in January. Yes. Dr. Stella, let's talk about the Respiratory Failure Program certification. Tell us more.
Well, the Respiratory Failure Program certification is granted by the Joint Commission. There is only 11 centers in the nation that has this certification. We are the only one in Montana. What we specialize on is all type of respiratory failure. Those patients that are dependent on breathing machines, they come to our facility and we're experts to get them off the breathing machine. We base our treatments on research-based data and protocols that we have developed through our clinical practice guidelines. And that's how we have been able to come across very good and effective outcomes to get those patients off the breathing machines.
Wow, that's amazing, and like you mentioned, one of only 11 in the entire United States. So you guys are doing wonderful things at Advanced Care Hospital of Montana. We want to thank you so much for coming on the show today. If you'd like more information, we'd invite you to give them a phone call or visit their website.